Hello, my name is Jessica Good, and this is my microbiology pathogen presentation. My pathogen is Helicobacter pylori. Genus is Helicobacter, domain bacteria, phylum Proteobacteria. And on the right-hand side is an image from a light microscope showing that the bacteria is gram-negative. H. pylori for short is gram-negative, has multiple flagella, is curved, spiral-shaped, but not tightly coiled, is microaerophilic bacteria, and can grow in anaerobic conditions. And on the left-hand side is an image from an electron microscope showing the H. pylori in the stomach lining. These are culture results from a urea test, and this positive is showing pink because the H. pylori is positive, is being exhibited. And then on the second one, we have a blood agar plate, which shows positive growth of small, convex, transparent gray colonies. And the third one is a gram stain of H. pylori, which shows gram-negative, small rod-shaped, and they're curved. H. pylori's life cycle. H. pylori is reproduced by binary fission. The bacterium replicates its DNA. The bacterium then separates its newly created chromosome from the other. Cytokinesis then occurs, and the cell is split into two daughter cells. The favorable genetic variations to increase complexity, meaning why it's able to live, is the ability of H. pylori to survive in an acidic environment using urease to neutralize it, because it turns it into ammonia and CO2, making the environment more basic. They have flagella to move them to the epithelium cells and are able to attach to the host receptors by adhesions. And on the right-hand side, there's just a little image showing the bacterial causes the ulcers. So it shows that the infection goes into the stomach line and the duodenum. Inflammation happens in the stomach lining, and this ends up making the ulcers. This is an image from our textbook, and it shows the Helicobacter pylori infection leading to the ulcerization of the stomach wall. So it shows the Helicobacter right here going into the mucus layer and into the stomach lining, and you guys can see in further detail of what is happening. The main disease that this causes is peptic ulcer disease. This syndrome includes gastritis, gastric and duodenal ulcers, and about 30 to 50% of people in the developed world can be infected with Helicobacter pylori, and about 15% of these people actually develop ulcers. The H. pylori can even cause gastric cancer in about 3% of the people who are infected with it. This bacteria is transmitted through fecal-oral route, meaning high standards of sanitation and proper and effective hand hygiene practices lowers the risk of infection. And evidence rates of infection seem to be disappearing in the developed countries because of this. The main reservoir of the disease is in the oral cavity. The bacteria may also be present in stool from an infected person, which also makes the infected person the intermediate host. The main thing that research shows as means of controlling the spread of this bacteria is to improve sanitation procedures for all, which seems to be improving, and providing education on proper and effective hand and overall hygiene. The pathogenicity of H. pylori needs at least 4 main cellular components to successfully colonize and establish an infection in the gastric mucosa: urease enzyme, flagella, spiral morphology, and adhesions. H. pylori relies on its ability to convert urea to ammonia to decrease the pH level in the environment and the stomach. This is not a contagious bacteria and must be passed directly from the host in the mucus or bodily fluids of the affected person to the oral cavity of the other person. So methods of transmission are fecal oral route, ingested from contaminated foods. The incubation period is estimated to be about 2 to 7 days to start showing signs and symptoms of gastritis, which is stomach pain, excess gas and burping, nausea, loss of appetite, and more things that are similar. Infection may or may not exhibit the signs and symptoms stated above. If known signs and symptoms, then the infected person could possibly go a lifetime with the infection because no antibiotic treatment will be sought and administered to kill the bacteria and cure the infection. H. pylori's pathogenicity continued. Diagnostic methods are biopsy of the stomach lining tissue, culture of the organism, urea breath test, which the patient swallows urea, and after 30 minutes, if CO2 is detected, then that exhibits a positive test. Exam on stools to detect antigens. The affected tissues and organs are the lining of the stomach, where the ulcers are, lining of the first part of the small intestine, which is the duodenum, where ulcers would be too. Some treatments are antibiotic treatment is necessary. Usually several antibiotics are needed, and this is usually given over a 14-day course treatment. And it can be used as tetracycline, metronidazole, clarithromycin, amoxicillin, and then one other thing is bismuth subcliate, which is Pepto-Bismol. And this is effective and used as part of the treatment plan. And here we have a little table showing first line, second line, third line, and what fourth line might be in order to treat the infection. So what I stated to you prior, just showing administration times and dosages in a little bit more detail. And we have a case study of a 42-year-old woman presenting with recurrent stomach pain, which is worsening. She has been taking Pepto-Bismol over the counter for the only notable treatment of signs and symptoms. And this is the only way she's getting any improvement of the signs and symptoms she's been having. The patient is seen by the primary doctor who suspects a peptic ulcer associated with helicobacter pylori. Bismuth is the main ingredient in Pepto-Bismol, which is able to kill the H. pylori but does not cure it, which is why she gets temporary relief of her symptoms but not long-term relief. The PCP prescribed her the antibiotic clarithromycin, but after 1 week of treatment, the signs and symptoms continue. PCP orders a stomach biopsy, resulting in a positive H. pylori infection, and confirms why she is still having the same symptoms. The PCP now prescribes tetracycline and metronidazole over a 2-week course of treatment, which cures the H. pylori signs and symptoms, and the patient no longer exhibits the signs and symptoms and does no longer have the infection. A few myths and misconceptions that I just wanted to share really quick is the first one, that ulcers are caused by eating spicy foods and stress, when in fact, Stomach ulcers are caused by infection with H. pylori. Another myth is ulcers do not lead to no more serious illness. And in fact, 3% of people infected with H. pylori will develop gastric cancer. Another myth is ulcers are not repairable. In fact, once the H. pylori infection is treated, the stomach lining is able to repair itself. But the H. pylori infection can reoccur in about 2 to 4% of people. Another myth is H. pylori infection is always detectable. Fact, some infected individuals can go a lifetime without showing signs and symptoms of infection, meaning they don't seek treatment and they're not given antibiotics to cure them of the infection. So they go their lifetime with it. And here are the references that I used in my presentation to find all of my information presented to you guys. Thank you.